Flu heavily affecting the whole country this week. We're showing you on this screen the progression from the beginning of flu season until now. So the darker the state gets in this graphic means more infections are being reported there. So the brown states have infections reported in half the state right now. And you can see the whole country, including Florida, is seeing some very heavy activity. In fact, just this week, Florida's seeing a jump from regional to now widespread infection. We want to show it to you another way here. Southwest Florida definitely not spared by the flu. We've got this red line showing patients they treated for the flu last year, and that peaked in February. And then you see Lee Health's already treating more people this week for the flu than they treated at any point last year, even during peak season. And that number typically gets worse before it gets better, so it goes up even more. Now, the number of flu cases is soaring in Southwest Florida, as we're showing you, and Lee Health is trying to take measures to prevent it from spreading. For In Your Corner's Carl Fortier in the field for you tonight. We're going to show you what kind of precautions the health system has taken to make sure that you and everyone else stay safe here. Carl?
Well, the spike in flu cases shot up to more than 330 cases the last week of December. That's about 3 times more than what we normally see in Southwest Florida. So Lee Health is urging people to play it safe and leave kids at home when visiting friends and family at the hospital.
And everywhere else in the United States, there has been an increase in influenza cases.
And that increase means many more people than usual are coming down with the flu in Southwest Florida. Dr. Mary Beth Saunders is an infectious disease specialist with Lee Health. She says they want to limit the number of children 12 and under visiting their hospitals, especially in ICUs and hematology and oncology units.
Not only to keep them safe, but to also prevent them from spreading influenza to others within the system. And children don't always have that body awareness.
She says kids don't always remember to wash hands, use hand sanitizer, and avoid touching their noses or mouths, which can put the flu bug into your body if you've touched an infected area like a door handle.
No, I can understand that if it's a temporary measure, then, because I know they'll have a lot of germs.
But Walter Judd of Estero says not allowing kids to visit intensive care and oncology units might be tough for some patients, even if it is for their own good.
For the people in there love to see their grandkids and children, so it's a hard thing to stop them from wanting to come to see them.
Dr. Saunders says while kids generally may have the most germs, everyone is encouraged to use these kiosks at the hospital entrances, dispensing hand sanitizer, tissue, and even face masks.
If you are coming in to visit, please make sure you use our hand gels that are distributed throughout our hospital system.
Now, Dr. Saunders says Lee Health will reevaluate the visitation restrictions each week, but says it could last until the end of flu season, which could be a few more months. In Fort Myers, Carl Fortier, Fox 4, in your corner.